Hello, everyone. Welcome and thank you for joining our webinar series. My name is Rose Boulet and I oversee the Office of Parent Services. Today's presentation is entitled Supporting Your Students in Time of Stress. With me today is Dr. Melissa Watts-Coet, Director, Clinical Psychologist, and Health Services Provider with the Center for Counseling and Psychological Health. Melissa will lead you to today's discussion. A question and answer session will follow after the presentation. So we kindly ask that you leave your questions until the end. As we've done in the past, we will use the chat feature to share information and important links with you while you use the Q&A feature to submit questions. This presentation is being recorded and a copy will be available within a few days on the OPS website and YouTube channel for your future use. Melissa, the audience is all yours.
Great, thank you, Rose. Let me just share my screen here. All right, and we'll start the slideshow. Okay. All right, so thank you everybody for signing on tonight. I know it's probably after work and evening dinner time, so I appreciate you all being here and showing interest in this topic. As Rose said, my name is Melissa Watts-Coet. I'm a psychologist by training, and I'm the director of the campus counseling center, the Center for Counseling and Psychological Health. So I've got a slide deck. It's about 20 slides that we'll go through, have some information to share about how you all can support your students and ways that UMass also supports students during stressful periods. And then, as Rose said, we'll open it up for some questions and answers at the end. So just to give a structure, a sense of the structure, CCPH, the Counseling Center, is part of Student Affairs and Campus Life. And as you can see, there are many spokes to this wheel. We're up in the top corner, Campus Life and Wellbeing Collaborative. That includes CCPH, residence education, so the RAs, the peer mentors, the Res Life staff who support students who live in the residence halls, the Center for Health Promotion, and then campus recreation. And so the four departments work pretty collaboratively on supporting students, both on and off campus students and their overall well-being. And the person in charge of our collaborative is Betsy Krakow. She's also a psychologist by training. She used to be the director of the Counseling Center at UConn. So we're in good hands there. As I said, the Campus Life and Wellbeing Collaborative is that spoke of Student Affairs and Campus Life that we fall under. And I think it's a nice complement between our four offices of ways that we tend to and take care of students' overall holistic well-being, not just their mental health, not just drug and alcohol and sex education, not just, programming in their residence halls or having fun things to do at the campus gym, but really approaching it as a unit and looking at the ways in which we, through our own departments and through the university as a whole, can support the different needs of student life and well-being. You'll see CCPH down here in the bottom corner. And really, I'll talk more about our services and what we offer, but our guiding mission is really to foster the psychological development, emotional well-being, and personal success of UMass Amherst students. And our values as a clinic and as a staff are around connection, resilience, and social justice. And we think about ourselves as a community of care. We offer a variety of services and programs and hopefully are able to meet students where they're at. Not every student needs the same level of intervention or treatment or mental health support. So we try to offer a wide variety and fit the needs of our students as best we can. Wanted to share some data with you all around particularly the impact of COVID on student mental health. There's a great data wheelhouse within college mental health. It's the Center for Collegiate Mental Health. They just released their annual report. and really showing, so this is self-report based on what clients are telling us, the staff in counseling centers across the country. And almost 73% of students are saying that their mental health has been impacted by COVID over the past 2 years. 69% of students are saying their motivation or their focus has suffered. Loneliness or isolation is pretty high, 67%. Academics, almost 67% as well. So really, and this is consistent with what we're seeing at UMass too with our students. We contribute data to the CCMH wheelhouse. So, it's all aggregate, no personal information is shared, but our UMass students are included in this data set as well. And you can see it's a study of about almost 100,000 students that they've included in this result. So you can look through the list, a pretty significant number of areas that have been impacted by COVID. This I thought was interesting to share. This is mental health trends in college counseling centers over the past 11 years since CCMH has been collecting data. And most areas are going up, sort of steadily increasing depression, general anxiety, social anxiety. What I found really interesting and maybe not surprising though was academic distress, this huge jump here in the past 2 years. And that's really COVID. And I think, faculty can validate that as well in their own experience, really seeing a steep increase in the level of distress that students are feeling around academics, switching to online learning, coming back to campus, maybe doing hybrid learning. So a big change there. Eating concerns also going up a little bit more steeply than sort of the past general trend. Family distress as well. We've heard from students over COVID times in particular, moving home was hard, probably hard for families as well as students. And just, even if it's very supportive and good environment, it's a big transition and it's not what students expected maybe to be, to be experiencing during their college. So that's reflected here too. The good news, I think, is that substance use is steadily declining over time. And, I think that's positive. Hostility, which is, aggression or conflict with others, that's also steadily declining over time. So those are positive, I think. This is our data. This is about CCPH here at UMass. Top reasons that students came into our clinic last fall. This most recent fall semester. Anxiety was for sure the #1 reason. 78% of students endorse that. Depression, 58%, and stress, 56%. I will say over the past number of years, we do a patient satisfaction survey, and the data is really consistent over time. Depression and anxiety tend to be the top 2 reasons that students come in. Most recently, over the past maybe 3 or 4 years, depression has taken second place and anxiety first. It used to be the opposite. So we're seeing increases in anxiety, and you can see just in the fall, there was a 20% difference. So pretty notable how much anxiety students are dealing with. Suicidal thoughts is 8%. So 8% of the students we see are having some level of suicidal ideation, which is not, unfortunately, it's not uncommon in college students. It's not any higher than national averages. Attention and concentration, 35%, that has increased over the past few years here in our clinic. And then self-esteem concerns, also, notable for why students are coming in. So what do we offer? We talk about, within college counseling centers, we talk about a comprehensive center or stepped care model. And so my graphic skills are really lacking. I'm a better therapist than a graphic design artist, but trying to, display here the level of different options that we offer, sort of from, up here, Let's Talk is pretty light touch, kind of a consultation or just a drop in. I'll talk more about each of these in a minute, but, sort of like the most entry level way a student can get services from us. all the way down to maybe our most intense level is when a student is in crisis and they need to speak to the on-call clinician or the emergency clinician. So we have a number of steps along the way, and sometimes students start at one step and go up or down, or they might work their way through a number of steps, or they might start, maybe on call and move into brief therapy, or maybe go to a workshop. So it's really fluid. It's not mutually exclusive. Students can be accessing different levels of services at the same time, but just different options. And then it's not a clinical service, but we do also offer a significant portion of our work is around outreach and consultation and education. And I'll say more about that in a few moments. So Let's Talk, that first, sort of that top tier of what we offer. Let's Talk is a national model. It started at Cornell, actually, and has been pretty successful in a number of colleges around the country. It's a drop-in kind of informal consultation. It's a 15-minute slot. Before COVID, it was always in person. Now we're doing it virtually, which actually has made it more accessible. Students are using it a lot more than they did when they had to come in person for this. But they can just pop in and talk to a clinician and say, here's my problem, or here's the situation, what should I do about it? And so we can give some guidance, give some advice. Oftentimes we're talking to students about, let's connect you to the Dean of Students office, or have you talk to your advisor, or maybe that's something you could talk about with your RA. So it's a place to get some guidance. I think one of the struggles at UMass is that it's so big. Students oftentimes aren't sure where to go for what, or who to talk to about something. And so we can be one of those resources where we can help students get connected to the right place. I've put links here too. So, if you're interested, you can check out our main website where you can get to everything I'm linking here is umass.edu/counseling. And then from there, you can check out all of our tabs and resources. We also offer a Let's Talk for faculty and staff. We often get phone calls or emails from faculty and staff saying, hey, I assigned a paper in my class and I got this one back from a student and they talked about having thoughts of death, or they have, they've been a really good student all along. They used to show up to class consistently. Now they're not showing up. They're not responding to my outreach. What do I do? And so this is an opportunity for faculty and staff to reach out to us and say, here's the situation. How do I help support this student? Or what should I do about it? And so faculty and staff take really good advantage of that. I think, they want to be supportive, and that's not their skill set necessarily of, they're not therapists or clinicians. So they really appreciate the opportunity to kind of get some guidance from us. And sometimes, depending on the situation, it might require a higher level of intervention. Maybe we do reach out to the student, or Dean of Students gets involved. But most of the time it's really helping faculty think through, how do I talk to a student about this, or what kind of support can I offer them? Let's Talk is free. It's totally, I say free, students do pay a health fee. They pay, for undergrads, they pay tuition and fees. And so some of our funding comes from those fees, but it's no cost to students out of pocket. They're not paying for the service. We also offer community conversations. These were new. We created them when we first went remote with COVID. And we needed a space where we could offer support to students, but not get into tricky licensure violations. We're all licensed healthcare providers, and so we have to practice within state and within licensing guidelines. And so we're hearing from a number of students who are either international or living out of state during early COVID times that they wanted support, but how could we do that? So these are informal. They're not therapy groups. They're really just kind of drop in. Students can show up once, or they can come multiple times over the semester. They're topic based. So it's a space for students to talk with each other. There is a clinician there to facilitate the conversation and to make sure everybody's okay. But again, we're not doing therapy. It's really just providing the space and maybe giving some icebreakers or some questions to get the conversation rolling. But really, students have found, we've seen our students really take advantage of these community conversations because they appreciate the opportunity to connect with each other, with their peers. So these are the ones that we have offered this spring. And so they're still open. Students can, if any of your students are interested, they can reach out and sign up to join any of these. And I think, they're a great resource. Again, there's no cost to the students. It's totally, free for them to come. The next level is workshop. And so it's a little bit more, it's still not therapy groups, but it is a little more psychoeducational. We're doing more skills building. There's more of a curriculum for these workshops. Again, they're topic-based, so managing emotions, ADHD toolkit. We've got one on intuitive eating, which is new this semester and really popular. A lot of students signed up for that. Overcoming social anxiety, which always fills. Self-esteem workshop, relationship skills workshop. I have to say, I think when I was 18 to 22 years old, I was, in a different headspace. Maybe I wasn't thinking about these kinds of things or being, willing to put the time and effort into working on these skills. And students are really just taking advantage of these in a remarkable way. They're almost always full or filling up. Sometimes we offer multiple sections of each workshop per semester so that we can provide the service to a number of students. And again, the workshops are no cost as well. Then we have therapy groups, which are therapy. So group therapy has shown to be very effective in a number of different presentations and diagnostic categories. Students, often we hear a little pushback from students around, I don't want to be in a therapy group with my peers, or what if I see somebody I know? My response to that is great. Like, you might see somebody you know and you might make a connection. And one of the benefits that comes from therapy groups is finding support from each other and giving support to others. Oftentimes that can be really rewarding to students. And so encouraging them to try therapy groups. Most of them are topic-based, like grief and loss, or understanding self and others. Some are population-based, like we've got a group for seniors, talking about graduation and what happens after college. We have a grad student group, a women's grad student group. So some options here. I should say all of our community conversations, workshops, and groups change a little bit each semester. Sometimes we offer the same one, sometimes we switch it up a little bit and offer different ones, but we have a full roster each semester and during summer session as well. Therapy groups, we do, a student could go to an 8-session group and have no out-of-pocket expense if they're not using any other service. If they're also in individual therapy, then we would get to a point where we bill insurance for some of the therapy groups. And we can, students have questions about that. We're always happy to answer questions, but we do bill insurance. We accept most major insurance plans, and we have, we can be flexible too. If cost is a barrier, we encourage students to reach out to us and talk to us, because we don't want that to get in the way of students accessing the support that they need. Let's see. So, okay, so we've done Let's Talk and community conversations, workshops, and group therapy. Next, sort of on that staircase, we have brief individual therapy. And this is by far what we get the most number of requests for. Students are very interested in having one-on-one therapy sessions. We do that for sure. And we have some, we have limited capacity. We can't provide individual therapy to all the students who might need or want it. So we tend to focus our work to be brief treatment, which depends on who you ask. There's a wide definition of what brief treatment means, but typically we see students maybe 4 or 5 times. That's our average, but there's really a wide range. Some students come once and get what they need, or we help get them connected to a therapist that they can see long-term, maybe in the community. Some students come multiple times because maybe they don't have the resources to go off campus, or they're too acute. They're in a tough spot, and they really need the support, and they can't wait for an off-campus provider to open up or a program to open up. So again, we're really our goal is to support students and to be flexible. So we don't have a session limit. But like I said, most of our students are sort of, our average is about 4 to 5 sessions because, excuse me, we are doing mostly telehealth right now for routine services. And because of licensing restrictions, students have to be physically located in Massachusetts during the time of their therapy appointment. So it's not ideal, but we've had students, maybe living in Connecticut, but they will drive over the border and sit in a Walmart parking lot and do their therapy session in Massachusetts, just to be on the up and up for licensure. There's some work and lobbying, at legislature levels to make, to change the requirements around that, around the restrictions around geography. But for now, it's only available in state. So that's a limit. We don't have a date yet, but at some point relatively soon, we will be resuming in-person sessions for students, which I think, and maybe giving students the option, would you like teletherapy or in person? And we found really a lot of students prefer teletherapy. They don't have to get dressed. They don't have to roll out of bed. Our no-show rate went way down. So, and students can be off campus, or they can be home for winter break in Boston or wherever and not have to be local. So I think even when given the choice, I think we'll still have a number of students that choose telehealth, and that's great if, it's making the services more accessible to everybody. We often have same day appointments available. So the way students can access our services is they can either call us at our main number, or they can go on through the patient portal, which is part of their electronic health record, the Medicap. They can go in through the portal, they can sign up for a first appointment that way, or they can call our office and sign up. Again, we have a limited number. We have about, depends on the day of the week, maybe 15 to 20 first appointment slots available every day. And sometimes we do run out. So if we run out, we'll send a message, an email follow-up to the students to tell them about all of our other options that they might want to consider, and we invite them to call back the next day. And we always ask students, is this an emergency? Can it wait until tomorrow? If not, they can see our on-call clinician that same day. So, students never have to wait if it's an emergency. A number of students want or need longer term work, or maybe don't live locally, or they're not in Massachusetts. So we have a referral coordinator, who can work with students to help them get connected to providers in their area, or even local providers who might do longer term work, or maybe a specialized type of treatment like EMDR or OCD work or DBT. Things that are beyond the scope of what we can offer at CCPH. As far as billing, so students through their through their tuition and fees, students have access to up to 4 sessions per academic year that are covered. If we see them more than 4 times, then we bill insurance. And again, like I said, we never want cost to be a barrier, so we will work with students to figure out a good plan. We can set up a sliding scale. We can make a payment plan. We can help connect them to low cost or free services in the community. So we have options, but just to know, after 4 sessions, we do bill insurance. Sometimes students will ask us about that because maybe they haven't told their parents that they're in treatment. Their parents might be the plan provider or plan holder. So we can talk with students about both, really the goal is to help students feel comfortable sharing with their families that they're in treatment. But in some instances, maybe they're not ready to do that, or it doesn't make sense to do that. So we can talk with students too about how they can be advocates for their own healthcare needs, and they can work with the insurance company to not have the EOB sent home, or to make arrangements around that. So we try, part of our role too, as being professionals working on a college campus, is to help coach students to function in the real world. And so sometimes we get calls from parents saying, I need to make an appointment for my child, and we say, well, I can help your child, but they need to call us, right? We're training them to be grown-ups. And so helping them navigate the healthcare system and find out what their insurance coverage and benefits are and how to make doctor's appointments, things like that. So we do have psychiatry at CCPH. We have psychiatrists and also psychiatric nurse providers, APRNs. So students are able to see us if a number of students are coming to school already on psychiatric medications, and maybe they need to continue that or have regular checkups or maintenance with a provider while they're here at school. Some students have never been on psych meds, but maybe they're at a spot where they need it or they want to talk about it and consider it. So we do have psychiatric staff who are available for that. Again, same licensure restrictions around students have to be in Massachusetts to see our providers for telehealth. And we do our psychiatry like anywhere, right? Psychiatrists are hard to get into. We try to be as available as we can, but we often work with students around, if it's something that can be treated and managed appropriately by primary care, we'll encourage students to either see a UHS provider or a University Health Services provider here on campus, or reach out to their existing primary care provider. In the US, most antidepressant medication is actually prescribed by primary care, not by psychiatry. Anxiety meds are often well managed through primary care. ADHD and sleep problems are also really well managed and appropriate for primary care. But when we're talking suicidality or bipolar disorder, OCD, psychosis, or the more severe or maybe comorbid with substance abuse or eating disorders, then we for sure want them to see a psychiatrist or APRN. So we'll keep them in-house. We do bill insurance for all psychiatry visits. So none of that is covered under the under the tuition and fees. So that is something that we talk with students about too when they make the appointments. And then crisis services. And this, like I said, is sort of the, the most intense level or highest acuity level of services that we provide. We have an on-call clinician 24/7, 365 days a year for mental health emergencies. With crisis, there's some more leeway around licensing restrictions. So students don't need to be in Massachusetts to access our care in a crisis. We can talk with them. If it's during business hours and they're on campus, they can come in and see us in person, or we can Zoom with them or talk on the phone. But we want to be as available as possible. We often get, we call them third-party calls, which is not the student who's in distress, but somebody who's worried about them. Maybe a family member, a sibling, a friend, a roommate, faculty member. So we are also available for that to be a consultant and to help make sure that the student gets connected and gets the support that they need. Don't often do cold calls to students. Sometimes we'll have a faculty member or a friend call and say, I'm really worried about this person. Here are the things that, they're not showering. They have seemed kind of depressed. I'm really worried about them. Would you call them and check in on them? And we usually, in those instances, we usually don't do that. It can feel pretty weird to a student to get a call out of the blue from a mental health professional. But what we can do is talk with the concerned other and help them figure out how they can have that conversation with their friend or their student, or provide them information about what resources are available. We often have roommates or friends walk into our building with their friend that they're worried about and say, like, I'll go with you, let's go to CCPH together. And that's great. We, if students want to bring their friend with them into the room and meet with the clinician together, we're happy to do that. Sometimes we have parents join in on either on the phone or on the Zoom session, or if they're on campus to come in. And, I've certainly met with families at times as a way to support the student and make sure that they get connected to the help that they need. We do also work with the International Programs Office. Students sometimes studying abroad have run into mental health challenges and they need support, or they need crisis services or access to care. And so we collaborate with IPO to help them get connected to whatever local crisis resources might be available. For crisis, there is no out-of-pocket cost. So that's, again, we don't want that to be a deciding factor. If students really need the emergency help, just like an emergency room, they should feel invited and welcome to come in and not worry about that layer of it. And then the other piece that we offer is outreach, consultation, and education. We do a lot of trainings on campus for different groups and organizations around all kinds of topics. We do a suicide prevention gatekeeper training, which is a national model that started at Syracuse University. We've sort of tweaked it a little bit to better fit our campus and our students, but every semester we train all of the new and returning resident assistants and peer mentors on how to recognize and respond to students who are in distress, not just suicidal, but students in any kind of emotional distress. We work with classrooms. Oftentimes faculty members will invite CCPH staff to come in and give a presentation to their class about our services, or maybe about stress, or things like that. RSOs, registered student organizations, we're often invited in to talk to different groups, student groups, about resources. We do a lot of tabling, if students talk about like stress fest, de-stress fest, or U-Fest, or all kinds of things. We pass out, we usually have tables there. We're trying to engage students, let them see our faces. Hopefully, then they can not feel intimidated or feel scared or worried about having to come into to counseling. We have some pretty fun swag that we hand out. Not as fun as Center for Health Promotion. They have a lot more fun things that they do, and games they can offer. But we try to just get out of our office and be present on campus as a way to engage with students as well. I mentioned the faculty staff Let's Talk office hours that we offer. Unfortunately, there are critical incidents that happen on campus, things like events that happen that have major, or have the potential to have major impact, maybe a student death, or knock on wood, maybe there was a fire in a residence hall and a number of students were displaced. So we have CCPH staff who would go out and kind of mobilize a crisis response, meet with those who are impacted, offer support, debriefing, follow-up care, but we do that as well. And then we also have professional training programs. So we have interns and postdocs and postgrads within the fields of psychology, social work, nursing, and psychiatry. So we have about 10 trainees each year who are part of our clinical staff. And so we're sort of building their skills and helping them grow into their own professions. And students have the opportunity. Sometimes they really like meeting with our interns because maybe they're a little closer in age, or they feel they can relate better to someone who's a trainee. So we offer that as well. And for our outreach and consultation and education, there's no out-of-pocket costs. We don't bill for doing trainings or presentations or tabling or anything like that. It's all, most of the time, if we're invited, we'll go. So we encourage students to take us up on that. I mentioned before, but just wanted to reiterate how students can access us. So that's our website there. It's umass.edu/counseling. We have a lot of information on our website about what we offer, how students can reach us. We have some resource guides and recommendations there as well. For emergencies, like anything else, if it's 911, if it's life-threatening. If it's not life-threatening, but it's an emergency, call our main number, and there's an option, it's a menu, there's an option to speak to the on-call clinician, and that's 24/7, including holidays. So students are welcome to use that. Students can also reach out to us through the patient portal. We have secure messaging set up, so if they're already in treatment, they can directly message their provider. We only check it during business hours, so we let students know, don't expect a response at 3 in the morning, but We do communicate that way. And there's online scheduling, like I said, through the patient portal for first appointments, for the community conversations, for the workshops, and for the Let's Talk. So we heard some feedback that students don't like to make phone calls. I get it. I don't love to make phone calls either. So we were able to set up a way for students to bypass that and to still get in. And then, of course, we're always available by phone during the day, and students are invited to call us with questions, consultations, non-urgent concerns. We get a lot of phone calls from families too, so you're all invited if you have questions. We can't share confidential information about your student unless they've signed a release, but if you have general questions or you want to share information with us, we're happy to receive that. Family support. There is a tab on our website for parents and faculty, and we have some links there and some information there on how you can support your student while they're at school. There's a great transition of care guide, which I can't take credit for. We tweaked it, we borrowed it, a lot of it from other sources, but we've tweaked it to be specific to UMass students. And it's really helping families and students prepare for when you're coming to college, particularly if you've been in mental health treatment previously, how to make sure that you get the care you need when you're here. And being clear about what's available on campus versus what you might need to look elsewhere for, and how do you do that. The JED Foundation is a national organization for college that focuses on college mental health and well-being. And we are a JED campus. We're in year 2 of a 4-year process where they guide us through to really look at what are the services and resources offered on campus, where are we lacking, where do we need to grow, what are we doing really well, and it's across campus. It's not just a counseling center. It's really the focus of JED is really sharing the responsibility for student mental health and well-being across all areas of campus: academic affairs, provost office, faculty, staff, residence halls, all the support services. So it's a really great organization. We have a lot of active projects that are happening around that. And one of the resources that JED offers is this Set to Go guide, which is linked here. And that's helping families and students really prepare for how to take care of their mental health needs at college. And then, like I mentioned, we have the parent FAQ page on our website that you can check out. Supporting your student, I will say there are lots of more specific guidance or advice around that, but in general, the things that I hear from students that they need from their families, or things that have been really helpful that they've gotten from their families, is staying connected with them. It's hard to sort of negotiate that balance of how often do you call. If they don't call you back, how quickly do you call again? But really just staying connected in whatever way you arrange with your student, letting them know you care about them, even though they're out of sight, they're not out of mind, right? So how do you support them in that way? And being available, letting your student know, even if they don't want to talk to you right now, maybe you're planting the seed so that they know when they do have something they're ready to talk to you about, or they need advice or guidance about, you're there for them, you're available, and you're willing to talk about it. Maybe, sort of like thinking about when they were in high school and you had to have conversation about sex or drugs, and it was uncomfortable and awkward and weird for most people, but just letting your student know that that you're available to have that conversation when they're ready is really meaningful. And the same goes for mental health. Asking questions, oftentimes most people, not just students, but most people find it hard to volunteer information about their own mental health. And so asking questions, not interrogating, but, starting the conversation, again, showing that you're interested and you care about them. And even though it's weird and awkward, you're willing to have those hard conversations. So, not just how you're doing or how's school going, but maybe how are you feeling? What's your mood been like? Have you been sleeping? Are you noticing any changes, or things like that? Just open-ended questions where you can get your student to engage in conversation. And then expecting change, even before COVID, right? Students go through a lot of change coming to college, and hoping skills that worked, when they were living at home and had the support of their families, maybe don't work so much here, or they have to tweak them a little bit, or maybe they could get by in their classes not studying too much or cramming the night before, and at the college level, maybe that's not working. And so expecting that they'll have to make some changes and supporting them in that process. Sharing your own experiences, even if it's not college specific, but when you've gone through a hard time, how did you get through it? How did you work on it? What resources did you access? I think can be really helpful. Oftentimes students put their parents up on a pedestal, or, especially if parents that have, successful jobs, or maybe they have an advanced degree, students tend to think, that you didn't struggle getting there. And oftentimes most of us did. I almost failed a couple college classes, so being open with your student, talking to them about the struggles that you went through and how you got through it can really be validating for them and what they're experiencing. So letting them know they're not alone. Also helping point students in the right direction. I mentioned earlier, UMass is a huge campus. It's like 32,000 students almost. And time and time again, we hear from students that they just don't know who to go to for what. I think campus tries to do, the services and the faculty and staff try to support students and help point them in the right direction, but sometimes we miss, or sometimes the connections aren't made. And so as family members, trying to help with that too. If it's an academic concern, pointing them to talk to their professors or talk with their academic deans. If it's a medical or physical health concern, talking to University Health Services. Housing or roommate issues, Res Life, they have a great staff who helps work through conflict and set up roommate agreements and work through things like that. And the same with off-campus student life. If it's mental health needs, our center, there's also the Center for Women and Community and the Psychological Services Center. So there's 3 different options on campus. We each offer slightly different things, but we're available for support. COVID-19 questions and concerns, there's a website. Thankfully, it's becoming a little less prevalent or necessary that students are needing to look there for information as the COVID numbers are getting better and things are slowly returning. But it's available as well, and it's a great resource. So those are my slides. I wanted to open it up. I know Ruth and Pallavi have been busy checking the chat and the question and answer board. So I'll stop sharing my screen maybe, and we can open it up. Rose.
Thank you so much, Melissa. These are some great information, resources, and in the background, we've been sharing the links with families. So thank you so much for doing this. We do have a couple of questions so far, and we'll go right through them. The first question was, can students participate in workshops remotely?
Yes, workshops, yes, students can participate. This semester, all of our workshops are through Zoom. So none of them are in person at the moment. And for the workshops, because they're not a clinical service, they're not therapy, students don't need to be in state. So they can be located anywhere that they have internet access.
Okay. And how can a student living on campus get a psychological consultation or treatment in person to deal with anxiety and depression instead of remotely?
So for right now, currently we're only seeing students in person for crises. For routine care, we're offering telehealth for the moment. We're still under DPH guidelines. The Department of Public Health is still recommending doing as much telehealth as possible, unless except for when it's clinically needed or emergency situations. So I think that will be shifting soon, and we definitely want to get back to seeing students in person. So it's just a matter of waiting for the guidelines to switch a little bit and to open up back up for that. I will say too, there are some providers and some other clinics outside of UMass that are doing in-person sessions. So if that's something that's really important to your student, they can reach out to us and we can help refer them, or they can, you know, Psychology Today is a great resource, a great website. We also have Shrink Space, which is linked on our own website, and students have access to that. They can put in search criteria for what kind of provider they're looking for, in-person telehealth. They can search by demographics of the provider and get referrals that way as well.
What is the difference between psychological service centers versus Center for Counseling and Psychological Health?
Sure, great question. Yeah, so CCPH, we are the main counseling center, mental health center for UMass Amherst. We only serve students, actively enrolled UMass Amherst students. Psychological Services Center, PSC, they are the clinic that's part of the PhD program for clinical psychology. So it's staffed, the services are provided by grad students who are in their second, third, or fourth year of working on their PhD. So they're all learning. They're supervised by licensed clinicians. They have the ability to do a little bit more longer term work than we do, but they don't typically work with students who maybe are high risk or high acuity because they're still in their learning stages. They don't offer crisis services. They don't bill insurance there either. They have a sliding fee scale, and there's usually, not always, but usually a little bit of a wait list there because it's a training clinic. You really need to make sure they're not overwhelming their staff, and you know, they keep a little tighter lid on that. So again, we offer slightly different services. They have great groups that we often refer to. They have a DBT group, skills group, and they see community members as well. So families can access services, children, individuals not associated with UMass can be seen there as well.
Thank you.
Sure.
For health concerns, if we take insurance, does the insurance covers all visits? If a specialist is needed, does the physician has to send a referral?
Great question. So anytime I talk about insurance, I feel like I always need to give the caveat of check with your own insurance company and your own plan to make sure, because there are so many details and, you know, fine points that we can't possibly know all of them. But in general, no, you don't need a referral from a primary care or from a physician to see a therapist or to see psychiatry. How much they cover really depends on if we're in network providers or out of network providers for your particular plan, what the copays might be. Some insurance plans have, you know, pretty low copays, some have high copays, same with deductibles. So it's really important to check with your insurance provider about what the coverages might be. If you have questions or you need to know more specifics, call our office and our office manager can help provide the information that you need so that you can get those questions answered.
And what does Center for Women and Community do?
Great, yeah, so they have a couple of different programs. They have a general counseling program, which are, I believe, mostly master's clinicians, so social workers providing general therapy. They do have interns, trainees there as well, but also licensed staff. And they don't bill insurance for that. It's grant funded. They're open to the community as well. So they're funded by the state and by different grants. So they have a different population that they serve, including UMass students. They also have a rape crisis. Actually, they changed their name, a sexual assault and support services branch of their department. So they offer 24/7 sexual assault hotline. They have advocates who, you know, if a student has been, or an individual, it doesn't have to be a student, if someone has been sexually assaulted, they have an advocate that is available to go with that person to the police to make a report. They'll go to the hospital to have a sexual assault exam. They can go to court with the individual to help support them through that process. So they're a great resource as well.
For long-term therapy, are there many students who are waiting to access outside providers who aren't able to receive services? How do you handle these cases?
Yeah, so it's tough. I think nationally and particularly in college mental health, the demand and the need has really skyrocketed for mental health care, and the supply chain just can't keep up with it. So oftentimes there are wait lists, there are lags in between when a student or someone is ready to access services and when they might get matched with a provider. Community mental health clinics in particular, it's not uncommon to have a 6-month wait. So we try as best we can to support students while they're waiting. Students who need a higher level of care than what we can provide. Maybe they need weekly treatment, or they need an eating disorder specialist or substance abuse specialist, or maybe they need like a intensive outpatient program. We just don't, that's beyond the scope of what we can provide at CCPH. So we can support students while they're waiting to get into that, while they're on that wait list. We can meet with them, we can check in with them, we can offer some skill building and support, do risk assessments to make sure that they're safe. But it's tough. And I will say it's gotten harder since COVID hit for individuals to get into long-term care, longer term treatment and care. The president in Biden's State of the State address, maybe a month ago, he did announce a lot additional and specific funding to enhance mental health services across the board, particularly in K-12 schools and colleges and universities. So I'm hopeful that funding will follow, and more graduate schools will have support for their students. It's expensive to go to grad school to become a clinician, so hopefully better student loan forgiveness, those kinds of things, so that we'll get more providers in the field as well.
I know you probably have a lot of instances where students or other students or faculty staff are referring students to you because those students feel lonely. They don't have friends, and they're isolated and they don't talk to many people. What type of services, or what would you say to students that are feeling lonely and need to reach out?
Yeah, great question. Yeah, I think loneliness is so prevalent in this age group and in this population, and particularly I think at large schools, large universities. Helping students to find their people, to sort of make UMass smaller in whatever way they can. So sometimes students make real connections with their colleagues or their peers in their academic department, or maybe in their residence hall, or maybe they join a student organization and they sort of find their people there. I think that's really important. And sometimes our role is helping students know where to look. It's not uncommon that we'll pull up, in session, we'll go on the computer together and we'll pull up the list of student organizations and say, let's look through these, and what might you be interested in? This one has a meeting tomorrow. Do you think you could go to that? Or can you find a friend to go to that with you? So getting students to engage in that way. We offer some groups, like our Making Connections group is geared towards freshmen and transfer students. UMass can feel really big and intimidating. And so that group is a nice place to help students not only meet some other students who are struggling with those same concerns, but also to learn some skills about how do I approach somebody? How do I strike up a conversation? How do I build some lasting relationships? Can be really, really helpful. And the community conversations as well. They're not therapy. We tell students, don't be afraid. You don't have to come in and talk about your deep, dark secrets. It's really just a place to connect to students who are going through something similar, maybe as surface level as academic concerns or, self-esteem. It can be really topic based and not have to, be a therapy group per se.
And the last question that we have is, what is the percentage of of the student body who access your services?
Great question. Yeah, so before COVID, it was right around 12 to 13%. During remote learning time, that number went down a bit. I think for a variety of reasons, students were accessing other support, or maybe being home, they didn't need the support from us. And then now that students are living back on campus and back in the area again, our numbers are going back up. So I expect this year's number to be again around 12 to 13%. So we see about just shy of 4,000 students a year come through our clinic. And we have, I didn't say this earlier, but we have about 35 to 40 providers on our staff and working to hire more. So we're building it, but the demand is intense. The need, I should say, not demand, the need is intense. And so just trying to provide different levels of service that meet students with what they need.
All right. And unfortunately, we do have a couple more that just came in, and we'll try to answer these if you don't mind.
Sure.
In terms of anxiety and stress, we know that a lot of them come from academic pressures and performance of students feeling that they are not meeting requirements or they are below expectancy. What is your advice for students who deal with these type of issues, and how do they seek help?
Yeah, I think that's a great question. There was actually just an article that came out about, I believe it was Cornell, their engineering department changed or limits the number of credits that students can take now. And I think that's something that, is worth really thinking about. I think there's so much pressure on students to not only overload on credits and courses, but to forego summer jobs so that they can get internships, but then that puts them in financial stress. And there's just so many pressures. And so that's one of the benefits of the JED committee that we have on our campus. We're working directly with faculty members, the provost office, deans, to say, like, what are you doing on the classroom side of things that either supports or damages student mental health? One thing we talk about is, like, don't set a deadline for midnight. Don't have your students turn in a paper by midnight. Set it at 5 p.m. because they'll get it done. And if it's at 5 p.m., then they can sleep. They won't have to pull an all-nighter or stay up. We're encouraging faculty to put statements on their syllabus that normalizes, like, it's okay to struggle. College is hard. Here are some resources. So really working with faculty to help them recognize the holistic approach to being a college student. It's not just about the grades or the academics or taking 20 credits, but really, like, developing their own skills and self-care and helping them leave college as a functioning adult, not just, a suffering adult with a degree. So that, I think is an important approach.
Yeah, that is very true. This one is not a question, but it's a comment, and I totally agree with the person who asked it. It was a thank you, and I'll read it for you, Melissa. It says, just want to say thank you so much for sharing this information with families. It's so helpful to have these resources, and helps to know you are there for them and care for the students' well-being. So I totally echo what that person said, and really thank you for being here and providing that kind of service for our families that are joining us. And is there any last minute advice or thought you want to leave the families with?
Yeah, I think that, I hope that families see us as partners. There's always limits to confidentiality and HIPAA and all of that, which sometimes might make us feel a little bit unapproachable. But really, so many times we are encouraging students, have you talked to your parents about this? Have you reached out? Have you let them know that you're struggling? We invite phone calls from parents, from families to, check in or to let us know what you're worried about with your student. And really, we can't do this work alone. You can't do this work alone. Academic side can't do this work alone. So how do we all partner together to support the students and help them be successful? So I appreciate all of you who are here and those who couldn't make it too, who are invested in, in supporting their student. And I really appreciate the time to be here. Thank you.
Thank you. We really cannot thank you enough, Melissa, for taking the time out of your busy schedule to be here and interact with us in this platform. We are honored and very grateful for your assistance. Family members, thank you for joining us. I hope this information shared with you was useful to you today. And I hope you'll join us again on April 6th at 6:30 for our next webinar entitled Renting Your First Place for students and families planning to go through the off-campus living next fall. If you still have questions or concern about CCPH services and ways to support your students' mental health, please feel free to reach out. We are more than happy to help. Until we see you again, stay healthy and go UMass. Thank you.
Thank you.